When I started medical coding career, so that time it was very difficult for me to code the charts very fast. Why means that time I don't know the regular medical coding secret tips which we can use for coding very fast. But after few days, I got to know that if we follow few small tips, we can code any chart in easy way and super fast. So in this video, we will learn ICD-10 real-time coding tips part 3. So these tips will be useful for you to code any type of chart in easy steps, and you can reduce your errors while coding ICD-10 And in my YouTube channel, you already have playlist stated ICD-10 real-time coding tips. So in this playlist, you can see two videos already I have published. So today our video number is 3. In the part 2, we have learned until alcohol use, F10 for disorder, Z21 for use. So basically, whenever you want to code for alcohol use, you need to check whether documentation contains disorder or use. If it is use, we need to use G72.1. If the documentation contains any type of alcohol disorder, we need to use F10 series. Okay. Next, we have drug use. If the documentation contains drug use, we need to code from F11 to F19 series codes. And also most of the time for mental or behavioral health coding, we will use mental disorders. So for that time, we need to use F chapter series codes. Okay. So and this comes under mental disorder. So mostly here also we can use F series codes. Next, depression. So depression is the most common diagnosis we will find during live coding. So here we will use F32 as well as F33 series based on the depression type, whether it is initial or recurrent like that, whether it is mild, moderate, severe. So based on these criteria, we need to use F32 and F33 series. Okay. So next one is dementia. Okay, so this is the manifestation of Alzheimer's disease basically. So for dementia, we will use F00 to F03. So basically here they are telling include cause if known. For example, if you know the reason for dementia, okay, so you need to code reason for dementia is usually we will call it as underlying disease for dementia. Okay, so next is Alzheimer's disease. Okay, so here in this Alzheimer's disease code, we need to use two codes. One is for G30 series and one is for F00 series. So G36 for Alzheimer's disease, F00 is for dementia. Okay, so here G30 code is underlying cause for dementia. F00 series is for dementia coding. Next, we have epilepsy. Okay, so for epilepsy, we will use G40 series codes based on specific types of epilepsy. Next, Parkinson disease also most of the time we will encounter in the live coding. For Parkinson disease, we need to use G20 series code. Okay. Next, headache. For headache, we need to use R51 series unless specific cause. So, for example, if the patient is having any type of accident on the head and patient is having the headache, so that time we will code that is the diagnosis. If you don't know the underlying cause of headache, you can code headache R51 as R code is the symptom code. If you know the underlying cause of headache, we need to code underlying cause. So that is the ICD-10 guideline. Next, migraine. So G43 series codes. So here also we need to code based on whether it is migraine specific type. Okay. Next, asthma also same. J45 series codes. Here also we need to code asthma based on specific type. Okay, so asthma starts with J45. In live coding, we will use asthma also multiple times or regularly. Okay. Next, we have COPD. For COPD, we will use J44 series. For pneumonia, we will use J18 for unspecified pneumonia. So if you know the organism reported for pneumonia, we need to use organism also. Okay. Next, TB. Usually we will call it as tuberculosis. For that, we need to use A15 to A19 series depending on the site of the TB. Next, we have malaria. So for malaria, we need to use underlying disease like B52, B54 series codes. For viral hepatitis, B15 to B19 series based on specific type of virus. Okay. So COVID-19, if the code is confirmed, we need to use U07.1 series. If the COVID is suspected in the documentation, we need to use U07.2. Okay. Next one is HIV. So if the documentation contains HIV is confirmed, we need to use B20 series code. If the documentation contains asymptomatic HIV, so that time we need to use G21 series. Okay. So next we have anemia. Here also we need to use D52, D64 series based on specific type. So here we need to check the documentation whether patient is telling only anemia unspecified or if the patient is telling any like iron deficiency anemia. Though those codes all are included in D52, D64 series. Okay. Next thalassemia. So this is also one type of blood disorder. So for thalassemia we will use D56. Leukemia. So leukemia is basically blood cancer, correct? So for leukemia we need to use C91 to C95 series based on specific type. As leukemia is a blood cancer, we have C codes for leukemia, C91 to C95. Okay. Next we have lymphoma or lymphoma. Okay. C91 to C85 series. So as lymphoma is a tumor, oma means tumor, correct? So tumor of the lymph glands. So C81 to C85 series. So wherever you see C series, you need to understand these conditions are cancers. Okay. For example, if we see myeloma, okay, tumor of the myelin sheath. So here you need to use C90 series. Okay. So if the documentation contains any type of endocrine disorders, we need to use E series codes. Most of the time we will get hypothyroidism, E03.9. Okay, so endocrine disorders, we need to use E series codes. As we discussed just now, for hypothyroidism, we need to use E03, for hyperthyroidism, E05, and obesity, E66. Along with that, we need to use BMI code also. Okay, so the documentation contains only BMI, we can't code. If you want to code obesity or BMI, we need to have both obesity as well as the BMI. Okay, so without obesity, we can't code BMI code. For malnutrition, we have E42, E46 series. For vitamin deficiencies, we have codes from E52, E64 series. So I hope this session will be very useful for you. So if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same-day surgery training, IPDRG, SCC coding, CCS certification training, please send message to 707-526-3939.